Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In today's episode of the Nursing Post, we discuss Group B Strep. Our goal is always to inform and start conversation.
As nurses, we've all heard about Group B Strep and the importance concerning pregnancy. But what is it? It's a bacteria. It's also known as Group B Streptococcus. It mostly lives in the GI tract and the genital tract. According to the CDC, most of the time the bacteria is not harmful to anybody. It doesn't make people feel sick. They do not have symptoms. Sometimes the bacteria invades the body and causes certain infections, and these are known as GBS disease. The bacteria does not spread through food, water, or anything that people might have come in contact with. How people get this bacteria is generally unknown.
Here are some statistics according to the CDC. In the United States, on average, each year, about 930 babies get early onset GBS disease. About 1,050 babies get late onset GBS disease. About 1 in 4 pregnant women carry GBS bacteria in their body. On average, about 1 in 20 non-pregnant adults with serious GBS infections die. The rate of serious Group B strep disease increases with age. There are 10 cases in every 100,000 non-pregnant adults each year, and there are 25 cases in every 100,000 adults 65 years or older each year. The average age of cases in non-pregnant adults is about 60 years old, and it is the most infectious cause of morbidity and mortality in neonates.
So Group B strep in adults can lead to bloodstream infections or sepsis, bone and joint infections, meningitis in newborns and infants, pneumonia, skin and soft tissue infections, and infection of the heart valves.
With Group B strep in pregnancy, it's usually found in the vagina and the rectum of women. When a woman is in labor and she gives birth vaginally, the possibility is great to pass this infection onto the newborn. It is rare, but happens to 1 to 2 babies out of every 100 when a mother does not receive antibiotic treatments during labor.
Some risk factors that we'd like for you to know about is young maternal age, Black race, preterm labor, and we're looking at less than 37 weeks, maternal fever during labor, prolonged rupture of the membranes greater than 18 hours. This is where you break your water. If you already had a baby with a GBS infection, you have a UTI during your pregnancy that was caused by GBS.
According to the March of Dimes, untreated, GBS leads to 1 to 2 in every 100 chances that your baby will get an infection. Babies with GBS infection can have the following illnesses: meningitis, which is an infection of the fluid and lining around the brain; pneumonia, which we know is a lung infection; infection of the heart valves; sepsis, which we know is a blood infection; and pneumonia and sepsis in newborns can be life-threatening. 1 in every 4 babies, which is 25%, who have meningitis caused by GBS develop cerebral palsy, hearing problems, learning problems, or seizures.
That's crazy.
It is.
The good news is the treatment's pretty standardized. So antibiotics given 4 hours prior to vaginal delivery is the standard for treatment of GBS. If the GBS status is unknown, the antibiotics should be given prophylactically. IV penicillin is the gold standard. If you can't take penicillin, you could possibly use ampicillin. If you are allergic to both of those, you could use clindamycin or erythromycin. If they notice that GBS is resistant to those, they could use vancomycin. And if the GBS is resistant to vanc, then IV cefalozolin would be the next treatment option. We had talked about STIs and superbugs and super infections a couple months back.
Yeah, a while back.
And just like with those superbugs, this group B strep is becoming resistant. So penicillin is the gold standard, but if you're allergic to penicillin and you want to use something like clindamycin, but it's resistant and then it's resistant to vanc as well, well, I mean, you're having to kind of keep upping the ante on these antibiotics to kill this
bacteria.
Because
it's a super bacteria at this point.
Right. So there are different times, and there will have to be cultures done, which is usually done ahead of time. So that way, you know, right before you have a baby, they do a pelvic exam and
absolutely
swab you. This is
why.
This is why.
In adults, most cases of GBS disease are among those who have other medical conditions. And some of those other medical conditions that put adults at an increased risk include diabetes, heart disease, congestive heart failure, cancer or a history of cancer, or obesity. As people get older, the risk of serious GBS disease increases. Adults 65 years and older are at a more increased risk compared to younger adults.
So there's no real preventative medication that you can take during your pregnancy, like an oral antibiotic ahead of time, because what happens is the bacteria can return before labor begins, which is why they like to do the IV antibiotic 4 hours prior to vaginal delivery. Researchers are currently making and testing vaccines to help prevent GBS infections in mothers and their babies.
You can find our resources on our website, thenursingpostpodcast.com, and subscribe to our podcast on your favorite platform. Be sure to leave your thoughts and comments, as they're always welcome. And thanks again for listening to The Nursing Post.